An in-depth look at the controversy and confusion about mammograms and when to get them. A federal task force report released about 6 months ago is prompting concern tonight among some local health care providers. They disagree with the recommendation that most women can delay having their first mammogram until the age of 50. The impact of those changes concerning to many, and it counters the messages long championed by the Madison affiliate of the Susan G. Komen Foundation, local doctors, and women alike. The Night Team's Maria Guerrero joins us now with more. Maria.
Well, Eric, the mixed messages are having an impact, forcing women to be their own advocates or face the possibility of delaying a breast cancer diagnosis.
I'm totally present with what I'm doing.
With every stroke of the brush, Cam French is grateful to have had this outlet during a difficult time in her life.
You're not thinking about what might be going on in your body.
French says a routine mammogram 3 years ago led to a devastating diagnosis.
In 2006, there was no sign of any kind of DCIS in my right breast. But 2007, there it was, within 12 months.
She credits the screening for catching the cancerous cells early.
For myself, I think it's very important because they discovered it. If I had waited a year, would I still have DCIS, or would it be a full-blown tumor by that time?
The 65-year-old now fears other, younger women are in danger of not getting screened early enough.
It's very scary, really.
It's a fear already becoming a reality.
We believe women are not getting their screening mammograms, and we're hearing of stories of women who say their primary care physician has told them they don't need a screening mammogram at this point.
Dr. Gail Cisney at the UW Carbone Cancer Center expects as mammograms drop, there will be delays in treatment and more serious cases of breast cancer will increase.
If women are getting less frequent screening mammograms, then they're going to be finding more palpable tumors, which will presumably be larger and have a delay in their diagnosis, have fewer treatment options, and not have as good a prognosis.
The center, like other major organizations in the country, has not changed its guidelines to match the U.S. Preventative Task Force recommendations. But the problem, Cisney says, is that some primary doctors are, and they're telling some patients not to get screened before age 50.
I've met other women who say, my doctor told me I didn't need one this year, so I'm not coming to see you. But unfortunately, some of those women I know, and they have risk factors. So I don't know that they were told correctly.
I hadn't had a mammogram in 2 years, and I found a lump and went in, and that's when they found a cancerous.
Jojine Retram credits dance for getting her through breast cancer.
Into the box.
She is also thankful she had the screenings done almost every year since her 40s.
And up.
Having caught the cancer in time, the 57-year-old instructor and dance studio owner can concentrate on the music.
And lower.
And hopes younger women like her daughter continue to get screened early and often.
I believe they're very important. In fact, my daughter just turned 32 and she's already had several mammograms because she has had some difficulties, and we didn't have breast cancer in our family, but now she's going to have to really watch.
It is a personal decision these survivors hope other women take charge of for themselves.
I would again be my own self-advocate.
You need to take care of yourself. That's why, you have to do self-exams, and that's how I found, mine.
Okay, so Dr. Cisney advises simply don't change what you have been doing. Continue with the old guidelines of a mammogram every 1 or 2 years if you are 40 or older, and continue especially with self-breast exams. But of course, you want to talk to your doctor, and if you have any doubts, you may want to seek a second opinion, Eric.
And it sounds like there's even debate or controversy over who's technically a high-risk category patient.
It is. That is another concern that Cisney is hearing. These guidelines are meant for average-risk women. But Cisney says some doctors are relying too much on the family history of a person and saying if you don't have that history, then you can wait. But in reality, Cisney says most women who develop breast cancer in their 40s, they don't have history of breast cancer. So she says the risk actually increases with age more than anything else.
Such an important story for women to hear. Maria Guerrero reporting that. Maria, thank you very much.